left side, Erb's point. Okay. The fourth intercostal space, the tricuspid.
Good. Good. Good.
Around the periorbital area, any tenderness? Very good.
Inspect the patient's spine for any abnormalities, lordosis, kyphosis, or scoliosis. Patient's spine is intact and aligned. You can just stand back up for me. And patients. So I'm going to palpate, feeling for any bumps, any abnormalities. Everything looks within normal limits. Her ears. I'm gonna inspect her pinna. Checking for any lumps or lesions. I don't see anything. For drainage, I don't see any. If I had an otoscope, I would pull the ear up and back, inspecting the tympanic membrane to look for a pearly gray. And also the other ear, inspecting for the same. Does anything hurt?
No.
No? Okay, great. Pulling, backing up, inspecting the tympanic membrane if I had an otoscope, checking for drainage. Everything looks great. Okay. Just let me see your hands. I'm just going to check your hands. Just checking for a capillary refill. Checking to make sure that the circulation comes back within 3 seconds. Perfect. Okay. I'm going to feel for any masses or lumps in the intercostal space. Great. I'm sorry, and I'm gonna palpate. I'm gonna percuss. Great, okay. I'm going to feel the pre-auricle glands, post-auricle glands, submaxillary, her throat, her thorax, her thyroid. Looks great. Can you swallow for me? Okay, and her subclavicular. To the head. I'm going to check the temporal pulse. Any masses or lumps. Okay, I'm just going to palpate a little bit harder. Okay, tell me if it hurts.
No.
Okay. Sorry,
Whatever that
sometimes
was.
Stomach muscle as well. Next, I'm going to assess for capillary refill in all 10 toes. And capillary refill is within normal limits. They fill back up with less than 3 seconds. I'm just going to take a look at your fingers one more time. And I'm assessing for any clubbing, and I don't see any clubbing at the ends of her feet.
So palpate and feeling around for any nits, any lice or anything, making sure there's no rashes. And if there, I'm going to push a little bit, making sure there's no lumps or anything at all. TMJ, make sure it's all right. And now I'm gonna go and test.
So, it appears don't feel anything soft or too hard to be concerned about. I'm gonna go ahead and feel for your temporal area, all right? And the next thing I'm gonna do is go ahead and check your TMJ. So go ahead and open your mouth, and then close. Open your mouth, close. Okay, that appears normal, which is right in front of your ears. All right. Next thing I'm going to check is your posterior auricular, which is behind your ears. Okay. What I'm looking for is like any swelling or anything of that nature. If you feel any discomfort, please let me know. Next thing I'm going to do is check your occipital, which is just kind of below your posterior auricular. Okay, great. Next, I'm going to check out your submental and your submandibular. Okay. All right. Next, I'm going to go ahead and check out your jugulo-digastric. Okay. All right. Next, I'm going to check out your superficial cervical. Okay. And now I'm going to go check out your deep cervical chain. So I'm just going to go up and down, kind of. Okay, great. Now I'm going to check out your posterior cervical. I'm going to push with my right hand and feel with my left. And then I'm going to push with my left hand and feel with my right. I feel no abnormalities. So you're good to go there.
5, the trigeminal nerve, I'm going to take a look at his temporal mandibular joint. Can you open your mouth, please? Close it and feel for any clicking. I'm going to check for neck symmetry and flexion. So can you flex? And then can you extend your neck, please? Okay, good. And then can you, okay, good. And then can you look side to side? Okay. And then also do it against some resistance, so push towards this hand, please. And then this side again. Okay, good. Okay, good. And then can you look side to side? Okay. And then also do it against some resistance, so push towards this hand, please. And then this side again. Okay, good. Now I'm going to do cranial nerve number 11, the accessory nerve. I'm going to have him shrug his shoulders against some resistance and push against me. Good. I'm going to palpate his temporal arteries here, his sinuses, looking for any tenderness or swelling. For any tenderness or swelling. Now I'm going to palpate his cervical lymph nodes. So I'm going to do the posterior auricular, the occipital, superficial cervical, submandibular, submental, the preauricular, the parotid, the tonsillar, and the posterior cervical. And the posterior cervical will be down here. Okay. Now I'm going to palpate his thyroid. So can you swallow for me? I'm going to displace it. And then again. To your chest. And then if his knees go up, that is an indication of appendicitis while he's doing this motion.
Pinch a couple times, and I see that comes back. We're checking the capillary fill on the toes, just looking underneath your toes to make sure that that comes back, which it does. Very good. So next, comfort? No. Okay. And maxillary? No. No. I'm going to go ahead and check to see if you have any kind of temporal mandibular problems here with your joint. Open and close. Very good. It's on your face.
Yes, 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 yes.
Any kind of excess earwax, anything bleeding, anything like that. We're going to go ahead and palpate. Any tenderness? Very good. So there's large. We're going to go behind your ears, front of your ears, behind your ears, in front of your ears, along your jaw. There's 3 lip nodes that exist there. Down behind your ear, on your neck. Now there's 2 lip nodes that are around the carotid. We're going to do that separately. There's 1. There's 2, and then we're also don't want to cause you to pass out. So we're going to go ahead, palpate, and then palpate. And the radials. Go ahead and bend this knee up, popliteal. Go ahead and bend this one up, popliteal. Okay, lay down with dorsal medialis, and posttibial. Posttibial. There you go. Very good. I know, it's hard to do that. Perfect. So we're going to go ahead and close your eyes for me. I want you to tell me if, I'm going to move your digits and you tell me if it's up, down, or medium.
Down. Up. Medium. Up. Medium. Down. Up. Down. Medium. Medium. Down. Up.
Perfect. Write it on your hand, facing you, and you tell me what that number is.